So today I'm delighted to introduce you to Dr. Sha Omar. He's a physician who's revolutionising how we understand metabolic health. In 2016, the National Science Foundation awarded Sean a $1.2 million grant to research reversing chronic disease using visceral fat biomarkers. And he's now conducted over 6,000 MRI scans and works with everyone from US senators to business leaders to the man in the street, helping them to eliminate visceral fat and reverse metabolic dysfunction. Here's the proof. He has a twin brother who doesn't follow all of his protocols. And when you see them side by side, the difference is quite remarkable. Dr. Sean's in his early 60s, but doesn't look a day over, well, I was going to say 50, but maybe I'll say 40. And his approach centers on a largely carnivore diet with fermented foods. And I did his 30-day challenge myself about a year ago. And I think the protocols are absolutely brilliant. And I cannot wait for you to hear what he has to say. So, Dr. Sean, welcome.
Well, thank you, Emma. It's good to be with you and your audience and your followers. I always like the opportunity to be able to talk about what I do, which is my passion in life. And so happy to be here, and thank you for inviting me.
Oh, absolutely. We're very glad to have you. So I've got some questions I'd like to go through, and I'm sure you'll be able to guide me on, talk about whatever you need to talk about, but just to start off with your career path, it's quite extraordinary. You were an undercover narcotics agent, then a criminal prosecutor. You've been in the US Army, you were a colonel, chief medical officer for a federal medical operations unit, and now pioneering physician in metabolic optimization. Can you take us back to when you were 47? When your own health started to go a bit south, what were the specific symptoms and health issues that you were dealing with?
Yeah, so I would say it was pretty typical of a average American, and probably fairly typical of an average European in many parts of Western countries that have a lifestyle of eating a standard kind of a American diet. We like to say here the standard American diet, and I'm sure I
call it the standard Western diet. It's just it's what we're all eating. It's what everybody eats.
Yeah. So that's what I was eating, which is basically I ate whatever I wanted to. I was guided mostly by palatable taste, whatever tasted good, and also was cheap. So I ate a lot of pastas and pizzas and things along that way, and I had declining interest and definitely a declining amount of exercise. So I was putting on weight. I was getting a big stomach. Was getting just basically fat, and along the way, I was acquiring medical conditions. And, that's a kind of sterile way of saying, I was developing medical conditions, but really the reality was I was increasing the amount of disease within my body. So by the time, I was 47, I was struggling with atherosclerotic cardiovascular disease. I had clogged arteries in my neck that were picked up on an ultrasound. My twin brother had almost an identical amount of disease within his arteries at the same time. I, in fact, had slightly little bit more than he did. I had erectile dysfunction. I had, the need to take medications to try to have a normal erection. I had a large prostate that was incredibly impactful on my lifestyle. For a 47-year-old guy,
wow.
I was having to wake up 4 or 5 times a night to pee. Yeah. And it was enormously disruptive to my sleep. You'd keep waking up. And if you're waking up that much, it was also happening during the day. I would have this big emergency where I'd have to go quickly run to, a bathroom and pee. And I lacked the ability to hold it. And sometimes I'd go running and it'd be a big emergency. And then, literally nothing would happen. It wouldn't come out. It was just strange. It was so dysfunctional.
Wow.
And
And
if I
that
managed,
was age 47. That was pretty early for all of that to be.
age 47, I had it very bad for a 47-year-old. And
Ooh.
if it did come out, it would be a very weak stream. And, people would be aware earlier of their disease process happening. Perhaps they would do something about it, but it is so slow, Emma, in my case, that I didn't pick up that my stream, was beginning to deteriorate and decline. I had no sense of vitality or vigor, how I urinated, how I peed. And
I think that's the way we
and then I
treat
was
so many of these diseases that we just think of as part of aging, the aging process, the inevitable process of aging, because we decline slowly. We don't realize it's a decline. We just think it's normal.
Yeah, and I don't like to use the term aging. I like to use the term more, what I think is more accurate, diseasing.
Yeah.
For most people, when they're accumulating numbers in terms of their biological existence, they're actually accumulating disease, but it doesn't have to be that way. In my case, was a florid example of diseasing. And so not only was it hard for me to pee, but I developed urinary incontinence at the age of 47. So I would, every trip to the bathroom, I had to put toilet paper, a wad of toilet paper in between me and my clothes because I would leak urine.
Wow.
And, that's a very bad, case. But there are listeners right now probably old enough, and let me, correct myself, diseased enough that that's happening to them. But with that, I also had eczema. I had restless leg syndrome where I would kick my legs, my feet all night long, and sometimes during the day. I had obstructive sleep apnea, so I snoring, and then I'd stop breathing. Then I'd start gasping for air. My wife would be terrified that I was dying. And I had terrible heartburn, gastroesophageal reflux, so severe I was taking 3 different medications, unrelenting, burning and discomfort in my chest.
People think that's normal. People think that's
They
so
do.
normal that they just drink some whatever or take some omeprazole and that's fine. And that's all you need to do.
And I was doing the same thing. I was taking over the counters on top of my 3 prescriptions.
Mm-hmm.
And, the symptoms would just return. But my condition was so bad that I ended up having metaplastic changes within the epithelial cells lining my esophagus. So what that means is the severity of my disease was so bad that the cellular characteristics, histopatological, the histology of that tissue was altered. And I had precancerous characteristics. And so it necessitated, I was diagnosed with a condition called Barrett's esophagus, which is a much more severe form of gastroesophageal reflux disease, more downstream. And it has a higher elevated rate of converting into esophageal carcinoma, which has a 90% plus mortality rate within 5 years of diagnosis. So what that means, it's a killer. Esophageal cancer is a killer. So I would
if you hadn't sorted this out, if you hadn't had a moment where you thought something's really not right here, I've got to do something more than I am doing, you wouldn't be here. You wouldn't be having this conversation.
No, I would likely have already had esophageal cancer. And also, besides all of the symptoms I was having, I had to be scoped with a fiber optic gigantic, I call it a garden hose, would have to go down into my throat and then biopsy my tissues every 3 months.
Wow.
Now, the average person might have that scope done one time in their lifetime. I had to have it every 3 months.
Okay.
And I had to have it so much that I eventually, because it would, take a whole day for me with all the sedation, try to recover, that I eventually just took that garden hose down. They do the biopsy, with no sedation at all. I would be wide awake because I couldn't keep giving up all these days all the time. So after the procedure, within a couple hours, I could go back to work. It was a terrible existence. And then my life would be, waiting in between every 3 months, stressed out, waiting for a diagnosis of cancer so I could begin chemotherapy or radiation therapy or whatever treatment my particular cancer, that I was going to be getting would necessitate. So I was just so stressed out. I was working in emergency medicine with all these medical conditions. And I'm, met a patient in the hospital who was very fit. And I was just, talking out loud, oh, I wish I was as lean as you are. I had this big gut and I had I looked pretty typical for my age, a dad bod. And he was a younger guy and he was very fit. And he said, oh, you'll lose weight if you just, he called it at the time the paleo diet, eat fermented foods, start sprinting, do those things, get some sunshine. So
yeah,
I thought that was a recipe to lose weight. I thought that was strange. It was very different. I didn't know what the paleo diet was. I read about it. It was a low carbohydrate diet. That was low carbohydrate, high fat, high protein back in around 2000 time period. And, that was around 1998 or so that I adopted that diet lifestyle. And I began losing weight. And I was, I had been previously bringing about a dozen apples, to the ER and skim milk with chocolate syrup in it, eating a low fat, high carbohydrate diet, just complete opposite of paleo. And within 1 year, I successfully lost my dad bod. But the thing that was most impactful was that I lost disease.
yeah.
So my state shrunk. I was noticing at one point that I was peeing into the toilet like I used to when I was a teenager, 20 years of age. It was a forceful stream. It wasn't dribbling anymore. I wasn't leaking anymore. And in that moment, and just like the disease wasn't detected as it was coming on, Emma, the disease elimination wasn't detected as it was slowly going away.
No.
And moreover, I wasn't looking for it because my expectation was in adopting those, recommendations of doing a paleo, low carbohydrate, high fat, high protein diet, and and sprinting and eating fermented foods was that the only benefit I'd get was I'd lose my big gut and lose weight. And that did happen. So I wasn't vigilant to disease being eliminated, but that's in fact what happened. And I reflected on the fact that my urine stream was much more vital and vigorous and youthful, healthy.
Yeah.
And I wasn't waking up.
When I'm coaching my own clients, this is the thing. They come to me for weight loss, but I say to them right at the start, the weight loss is just a lovely side effect. All the other things we're going to fix will be, that's my main focus is regaining their health. And they don't expect to do any more than lose weight. And then they hope they're going to be able to stick with it. And they change completely following a very similar diet to the one that you advocate.
Yeah. So I did those things. My disease went away. My erectile dysfunction went away. My eczema went away. My Barrett's esophagus went away. I was pronounced cured. I no longer, my epithelial cells returned to a complete healthy, normal state. I no longer needed to have biopsies and scopings anymore or take any medicines. My obstructive sleep apnea reversed. My restless leg syndrome reversed. All of my conditions reversed. I was just, so happy. But at the same time, I was furious because none of the treatments that I'd been doing along the way were seemingly doing anything other than kind of temporizing the symptoms, but the severity, the underlying disease continued to propagate and advance. And it wasn't until I changed my lifestyle that I saw this relief and elimination of disease. So to comment on your own observations that many of your clients, talk about weight loss, but the real focus needs to be on the elimination of disease and their medical conditions, reversing it and improving with a better approach to living, doing strategies. That the sad reality is that for the most case, people, the driver is they want to lose weight because they're frustrated, but we're losing that drive, that driver, because so many people are now heavy that's being attenuated and diminished because it's the norm today. People being heavy and obese, and so we're losing so many people to obesity, but more properly to disease. And so I stand for the notion that human beings should not be diseasing, they should be optimizing. And so the reality is you can actually improve, and I'll hit you between the eyes, anybody listening. You should actually improve your health relative to where you were when you were 20. And the scientific defensible reason for my to assert that is you learn more and you become a better human being. We become more intelligent from the age of 20 to 30 and 40 because we learn more information. What if we learned how to improve our health more? Then I would submit to you, everybody would begin optimizing their health. They would literally become better human beings biologically. And I like to make the point that to predict that in the future, in our lifetime, we will see the very best, highest paid, highest performing professional human beings will be people in their 50s and 60s, maybe even 70s, playing professional football, soccer, tennis, any of the professional sports, because we will have educated them to what you and I already know, that you can eliminate disease through certain strategies and a focused approach to following the correct metrics, and give them those strategies. They will have the health of a 20-year-old, but even become healthier because they will be more disciplined, they'll have more knowledge, and they'll have decades longer to improve their health and improve their performance. They will literally have decades more experience playing tennis, playing soccer, playing American football, playing any basketball or any other professional sport. And so the younger generation that are just getting started professionally in their 20s will not be able to keep up and compete with those men and women in their 60s. Now, that seems highly implausible to the average listener here, but it's complete certainty from my experience, because I take people in their 30s and 40s and 50s and 60s and even 80s and dramatically improve their health and begin to exploit all their knowledge that they have to make them better living human beings. So the most important take-home lesson probably of this podcast for your listeners is there's no discernible end to the health of a human being, and it's completely independent of their age. If there is an association at all, it should be scientifically that the older you are, the healthier you are. But for most people, their experience is completely different because they've acquired more disease.
Yeah, completely the opposite. So you call visceral fat the enemy, and you identify it as one of the 4 hidden killers. Can you explain in simple terms why visceral fat is so much more dangerous than the subcutaneous fat, the fat we can pinch? What's actually happening inside the body?
Yeah. So maybe I'll show a picture so that people have an idea when I'm talking about visceral fat, what it is, where it is.
Yes, some people they've never even heard this term. They don't even. I mention this to people and they just look at me blankly. So
yeah,
like we're
certainly, and
talking to
there will be people that will
people that don't know
be watching this and won't have any idea. So visceral fat is best seen most accurately in the highest degree of resolution in a MRI scan. An MRI scan is different from an X-ray or CT scan because those two modalities use radiation, ionizing radiation, to be able to detect visceral fat and detect disease. But an MRI uses safe magnetic fields. So one, it's beneficial because it has a higher degree of resolution. But two, it's also safer. I can rescan somebody just exposing them to a magnet instead of exposing them to radiation. So I'm not limited in terms of how often I can scan somebody. And in many cases, we were scanning people every single day to detect and track the amount of disease they were getting or the amount of disease they were reducing. So on an MRI scan, muscles, which these are these structures here, the oblique muscles and the abdomen. This is an abdominal MRI scan, show up as dark, and bone shows up as dark. This is a vertebral body, part of your spine. It's one of the bones in your back, and it's a lumbar, actually L3, the third vertebral body in the lumbar spine. The two dark structures next to it are the psoas muscles next to the spine, the iliopsoas muscles known as the core, and then these two dark structures here are your abdominis rectus, which makes up your six-pack. For those of you that might want a six-pack or an eight-pack, or to see those abdominal muscles on your abdomen, those are them right there. And fat shows up as white. So all the white that you're seeing here is actually fat. And there are various different forms of fat that inside the body, and they have very different biochemical makeups. And if you're listening today, you probably have this vague understanding that fat is a bad thing, and you want to get rid of it. But I will submit to you, take whatever poor regard you have for the fat and recognize there's a type of fat that's about 100 times worse than what you're assigning to it. And then there's also a type of fat that's very, very beneficial, and I hope to get into that too, that's about 100 times better, or maybe 1,000 times better than you think about fat. So there's fat that's very beneficial to you and improves your health and your quality of life. And there's numerous areas of fat inside your body that are very destructive and disease-causing. So visceral fat, to your question, is this white mass inside the abdominal region. This is the belly button. So everybody has a belly button, and it's a slice from the belly button with somebody laying on their back. This is their back muscles. These are their love handles. You can see the big chunks of fat that most people start accumulating, in their 20s, 30s, and 40s. And by the time you're in your 50s, like this individual, you've got gigantic fat pads called love handles back behind on your backside. And this is the anterior abdomen. And all this white stuff is the accumulation of fat within the abdomen. The white stuff accumulated inside these muscles is muscle fat called myosteatosis. And it's a highly inflammatory. And the problem with visceral fat and muscle fat, including the inflammatory fat going into this back muscles, paraspinal muscles, is the recti spinae multifidus muscles, which keep your back, is they degrade tissue. They cause disease. They reduce performance of organs and muscles and hormones and cells and all structures in your body are being degraded by this continuous collection of fat in your abdomen and collection of fat within your muscles and collection of fat surrounding your heart, which is really just a form of visceral fat. And the reason it's so inflammatory is because it's spewing out inflammatory molecules 24 hours a day. Every minute, every second, it's releasing these inflammatory molecules coming out. And, just to be a little scientific, the interleukins, it is tumor necrosis factor alpha resistant, a whole host of these adipokines, cytokines, chemicals that leach out and travel immediately to tissues around it. So you have the colon being inflamed with this bed of inflammatory fat around it, small intestines, the pancreas, the aorta. So in surrounding the aorta is inflammatory fat that's directly impacting it, but it also gets absorbed and travels systemically. The abdomen through the portal vein is absorbed and then goes systemic as it passes through the liver, contributing to liver disease and a fatty liver. It then goes throughout the whole body and contributes to disease and inflammation. And I will go so far as to say that I never saw a single form of chronic disease that doesn't have some origin in visceral fat. And the more important thing is, I never saw a chronic disease that somebody was afflicted with in 6,000 people that we studied for the National Science Foundation in America, that their chronic disease didn't improve when they got rid of this visceral fat. So it's really the single most important thing a human being can do to get rid of disease and improve their health. And unless you have absolute clarity about what that is, you're not going to achieve it. And for the average human listening, they will surmise and believe it's lowering their cholesterol because they have faith and trust in the conventional healthcare system that is signing to them in encounters with physicians and healthcare providers that are telling them and putting them on drugs to eliminate their cholesterol.
And meanwhile, they're scared. They're scared not to believe what their doctor's telling them. And that's
well, they're afraid they're going to have a heart attack because, heart attacks and strokes are the number one killers in America. But, I'm a retired Army colonel. One of the strategies that we did when we had something really important and we didn't want other people to know about it, not everybody else, is we created a ruse. So we might build a secret structure, that's really important, hide it, but we'll build a structure above the ground and it will help explain why we got all this dirt we're moving around. And everybody pays attention to the structure on top of the ground that really doesn't matter. And they don't know about the one buried in the ground that really is the most important thing. So I like to use that analogy and say that's what big pharma is doing. As long as they got you talking about your cholesterol, which does nothing. I mean, if you think that lowering your cholesterol is important, well, then let me ask you to name one human being that eliminated their cholesterol, optimized it, got it low, and said it changed my whole life. Everything got better from that point on. It doesn't exist because it doesn't happen. It's like Brownian movement. It's a lot of discussion and movement and drugs that accomplishes very little in terms of eliminating disease. But as a health optimizing physician who specializes in improving the appearance of people, improving their level of health, eliminating their disease, and also improving their performance and the quality of life, I can elect to follow any metric I would like to or need to most optimizing human beings. And this is my bread and butter. This is how I get human beings better, is getting rid of this visceral fat and not ever getting them to eliminate the cholesterol. Get rid of this visceral fat, get rid of this fat in your muscles, and get rid of the fat that's around your heart. And you will, nothing else will so dramatically improve your level of health, the elimination of disease, how you look, how you perform, and how you live.
And how your brain works.
Yeah, and that definitely includes, all aspects of your performance. So you're not just going to become a better tennis player. Your brain is going to analyze and information, cognitive capabilities substantially improve. My memory was so impaired at the age of 47 that I would walk into, where my wife was in a room and tell her something. And she would look at me and tell me straight in my face, you told me that just 2 hours ago. And I would look back at her astounded, like my wife was losing it. And I'd say, no, I didn't. I haven't told you that.
Yeah, and it's one of the things that people really bothers them. I mean, but they're so relieved when I tell them that it's reversible, that within a few weeks this is going to change.
Completely reverse.
Change. It really
completely reverse. That's not happening anymore. And what woke me up was
it's so common for people. It's just one of the things that they always say on the brain fog. And I can't remember why I walked into a room and just and yet it takes no time at all for it to start going away.
Well, if I'm a physician MD and it was happening to me, and my wife walked back in the room and she was crying, and I thought, well, it's the problem is with her. But when I saw she was crying and she's 8 years younger than me, I began to question whether it could in fact be the case. And shortly thereafter, I learned about eating low carb, high fat, doing sprints, eating fermented foods, incorporating that into my lifestyle. And all my memory impairment, my cognitive capabilities, the decline in my cognition, completely reversed. And interesting, a lot of my physician colleagues who dismissed me initially saw that my intellectual capabilities were substantially improved relative to my early existence when I was in medical school. So I've become, I'd like to say, more intelligent. I've learned a lot, but my capacity for analyzing data is substantially improved, and it continues to improve. So I can go through medical studies and analyze data a lot faster than what I normally did. And I understand it's extremely rare that I encounter information that intimidates me or isn't clear. Now I can go through very dense science and have at least a remedial level understanding of it. And before it was, I'll be honest with you, I was a doctor, and a lot of science, I would be like, well, I don't quite understand that. And I went into a field of medicine called emergency medicine where, it was more procedures, and you didn't have to have super deep, intense understanding of sophisticated, complex mechanisms. You just had to fix the bullet hole in somebody. You had to fix the trauma. You had to fix the clogged artery that was causing a heart attack. So it appealed to me as a more simpleton. Yeah, it was. There was a lot of mechanical application to it. And then I lost interest.
I remember thinking at around mid-40s, like you, thinking, God, is this early onset dementia? It was worrying me, because my husband would say to me, no, what do you mean you can't remember that? Oh, we already discussed that. And it was really, I was covering it up, but it was worrying me.
Yeah, well, that's one of the signs that neurologists look for. People, when they start covering it up, that it's a really strong indication that it's in a more advanced form. So it really, any degree of memory impairment that you can detect is problematic and should suggest the need for course correction on your lifestyle. And even if I'm speaking to a man or woman who's listening today and you don't detect any changes, then let me just ask you, why are you going to be any different than anybody else? It's going to happen eventually. And you need to identify the very best metrics for tracking how do you improve health and how do you eliminate disease. And you'll never be able to put out, stop disease with this dumpster fire, I like to call visceral fat inside of you, that's spewing out toxic, hot gases that are just destroying your body all over. And the other interesting thing is, in science, the body's master antioxidant that reduces oxidation and protects you against the ravages of oxidation, which are inescapable to every human being and every animal that exists in the planet. You will have exposure to oxidation, and it leads to aging. Well, your body produces this master antioxidant called glutathione, and it's perfectly created in the right amounts. And to the extent that you live better, you'll produce more of it. And let me just tell you, if you're going to try to take exogenous glutathione and not address your visceral fat, you're going to fall apart because you cannot consume enough glutathione to deal with the amount of inflammation that is buried in your abdomen that you don't know about. Glutathione is predicated on physiological small amounts that get produced oftentimes by mitochondria just in the byproduct of producing energy, ATP. Normal living gives you oxidation, and glutathione covers that. And it helps a man or woman look healthy. Their skin isn't so old and full of gels and hanging and wrinkly. And their breasts don't sag. Their pectoralis major muscles don't sag. Their muscles on their arm have normal, healthy tone and don't sag. But you only get there when you put out this dumpster fire. So unless you are aware of it, and more importantly, eliminating it, you're going to fall apart like everybody else. Yeah. Good luck with your life if you're going to blow this off.
So on that topic, with people thinking they can take glutathione to improve their health, but not dealing with the root cause, which is the visceral fat, what's your opinion on strategic supplementation? So, for example, it's suggested that it's impossible to get enough magnesium in our diet because of how depleted our soils are, our modern farming methods, the food chain. So what about supplementing? What about supplements like everybody takes vitamin D because we're told that vitamin D is important for our health? What do you feel about that? Do you feel that these synthetic man-made supplements are necessary, or we should be able to get all of this from our diet?
Well, my attitude about supplements is that their name is pretty good. It's kind of a supplement, but they're not going to replace the endogenous produced form of, in nature that God and our bodies have made available to us. Yeah. So you're diving down into basically processed foods rather than eating a glorious, super healthy piece of meat or a food in more natural form. You're eating a synthetic form, like a fake, fake burger or something. And it just doesn't have the same nutritional capabilities. So when you take synthetic vitamin D, it pales in comparison to the glorious produced vitamin D that your body will make and perfectly regulate without fear of vitamin toxicosis, meaning too much vitamin D, because it is a fat-soluble vitamin that is capable of being stored within our fat. But if you produce it in your body through natural production, exposure to sunlight, then you'll have adequate amounts. You never have to worry about too much accumulation of it. So the natural form always does outperforms the synthetic. But there are people who need some supplementation because they're unable to get out into the sunshine by virtue of their lifestyle. Maybe they're paralyzed. Maybe they live in an area where they just don't have exposure to geographically to optimal levels of sunshine. So you're better off looking for the natural source. And I spend a good portion of my day, actually, Emma, looking at new drugs coming out.
Mm-hmm.
And I'm doing exactly the opposite of what Big Pharma does. Big Pharma looks at natural substances to identify synthetics that they can produce and get a patent on and sell to make money with, because of its synthetic nature, all the side effects. I go back and look at that particular synthetic and then identify the natural target that they had previously stolen and exploited and used. And that those are the natural substances that I will bring into my body and look for in natural form. Magnesium is something that I think a lot of people probably do need to supplement with, just by virtue of epidemiology, where we see large studies showing that it is the number one nutritional deficiency for most people. Yeah. And so I think they need to take it. But let me speak to another aspect to health that nobody really talks about. And that is, I have a definition for health that I have several definitions of health, but one of them is your health, your expression of your health, the quality of life is dependent upon your supply, what you have access to that you bring into your body, and then your capacity, how your body absorbs it. And it's that second part, your capacity for absorbing nutrients, absorbing supplements, for absorbing medications, is critically important. And it's an enormous variable that changes between humans. Yeah. And have you ever once heard anybody talk about that? Physicians should be educated to capacity to understand and properly dose. Instead, they're trying to measure 5 milligrams, a difference between 1 milligram, 5 milligrams and stuff. What about the man or woman that absorbs that much more efficiently versus the man or woman who absorbs it so less efficiently? They need more. The first one needs less. There's no discussion about it whatsoever. Because if they did know about this, they might start thinking about how natural substances could be enhanced in the same manner by adjusting the health of somebody. And anything that might shed light on this concept of optimizing health or declining health that could be measured and could be detected is just something the system pushes away. Yeah. And I'll point the fingers at Big Pharma. I think Big Pharma has an enormous role in suppressing this kind of knowledge when it comes to medical professionals. I went to medical school not to make money. I went to medical school to help people out. And I would say that the majority of my physician colleagues had that as part of their intention when they went to medical school. And then slowly along the way, you become inculcated within the metrics of a system that tells you you're only a good doctor based on revenue, RVUs, how much you do, how much medications you prescribe, all the tests you do, because all the metrics that are available are designed around the system that exploits disease while allowing it to propagate, kicking the can down the road, and then doing more things to help people, but you never really reverse this disease. So if you're listening today, you want to understand that your health is turning on what you bring into your body, expose your body to, and it's more than just eating, but also the level of your health and your ability to work and utilize through optimization the bioavailability of many of these things. So you may in fact go with far less vitamin D, your necessity to have vitamin D or vitamin C or any other metabolite that might be available to you that you might be desirous of or supplement, just because you are so incredibly healthy that the receptors on those cells respond to a much lower level, and you don't need as much as the average person. And having said that, that notion of the average person, it is predicated upon a very, very diseased human being, because at no point in our existence, however long you might believe that human beings are around, archaeologically and anthropologically, I should say, rather than archaeology, it's anthropology, medical anthropology, we have never had more disease, particularly chronic disease, in the history of our species than presently, 2025. And it continues to get worse. And so there's a real need to be aware of that fact, that the system is not working, people are falling apart, they're getting more disease. And the sooner you realize that this notion of diseasing is a reality, and it's all entirely based on your lifestyle, the sooner you can start doing something about it and changing the way you live, learning about what you really need to do to be able to live better.
Yeah. So let's talk about your protocol. I'm conscious of time. We only have about 15 minutes left. Your protocol centers largely on a carnivore diet with the addition of fermented vegetables and dairy. Can you walk us through the scientific rationale for why this combination is so effective at eliminating visceral fat? Because, we've been talking about how one human absorbs better than another human. One human makes more of a vitamin or a substance than another human does, depending on how essentially healthy we are. But if you go to the doctor and you talk to your doctor about something that you've got wrong with you, he doesn't even ask you what you eat. They never ask you what you're eating. It's of no interest to them. So your starting point is changing the diet. So how do you go about doing that? What do you start by saying to people?
Yeah. So I'm reminded of one of my clients who came to me once, and he went to a new doctor. He got yet a new doctor, and the new doctor told him, he asked him, what should I be eating? And the new doctor said, eat whatever you want, and we'll address any problems that you have with medication. And he was sincere as can be. So eat what you want, and we'll give you pills. That was the solution. So that client ended up going to another doctor, and I'm sure that doctor was confused why they didn't want to go with them. But the answer is, I start with a carnivore, a meat-based diet. So meat is, without exception, the most nutritiously dense food that you can consume. It has more nutrition gram for gram than anything else. And so it's a starting point. And then I add to it fermented vegetables, fermented fruit, and fermented dairy. And the reason I do so is that when we added in meat, people did better in the 6,000 people that we're studying with regard to these targets. The meat eliminated visceral fat, heart fat, more quickly and easily than just eating a vegan or vegetarian diet. It produced better results.
I've heard you also say before that eating the fermented vegetables with the meat or fish enables you to eat more meat. It somehow increases the appetite.
That when we added in fermented vegetables with meat, that we got even faster acceleration of the fat around the heart and fat within the viscera surrounding the visceral fat and muscle fat. So the ultimate combination, the way of eating, is eating the healthiest form of meat and these fermented vegetables in fermented form, vegetables in fermented form.
Mm-hmm.
If you just eat meat and vegetables, what you're missing are these living microbes that contribute to your microbiome. And what's really changing people's levels of deadly fat inside their body and around their heart and in their muscle is the microbiome. The microbiome is the single most important feature of your health. It is actually more important than visceral fat. Visceral fat is downstream of a disrupted microbiome. And I, in fact, achieve the very best results eliminating visceral fat, muscle fat, and heart fat by adopting strategies that enhance and improve the microbiome, which is the collection of organisms. If you don't know what the microbiome is, I would exhort you to write it down, begin studying it in Google or AI, read about it, every article you can find that comes your way, casually or intentionally, about these collection of organisms. They're living species of bacteria, viruses, fungi, yeast, archaea, and life forms that we don't even yet know about, that we will be classifying and identifying. They number around 70 trillion to 100 trillion. I think we're going to just keep adjusting that number up higher and higher as we find these new life forms. And we don't really understand all of them, but here's the key. Here's the really important key. The man or woman that gets more of these beneficial microbes inside of them with the greatest amount of diversity, trying to build an African safari, meaning you want a lot of balance. You want a lot of these things. You don't want to just have 70 trillion of the same species. The African safari is magnificent along with the Amazonian rainforest because of the diversity of life present within it. And it works so well in nature, in our planet. And we physicians have failed to understand that that model is available and achievable and needs to be exploited for our beautiful bodies to adequately duplicate and benefit from the diversity and strength and health of our own internal safaris and rainforests inside of our bodies, within our gut, and even on your skin. And for most people, the concept of a microbiome, they'll attribute it to inside their gut, but you actually have a microbiome that's on your skin. And sadly, the majority of people are wiping out with soap and antiseptics and daily showers and chlorinated water that are, eliminating your ability to build a safari on your skin and in your hair as well.
Well, we've been made to be scared of germs ever since refrigeration was invented, that we should clean them up, we should obliterate them, they're going to kill us. That's how we've been going along for decades. So when you say to somebody, you don't need to wash all the time, embrace that microbiome, share it with other people, touch each other and share your bugs. No, that's weird to most people.
It is indeed. I mean, it's was part of our species for the longest period of time. We're in fact fundamentally attracted to people, and you want to be intimate with people that you find biologically attractive and cozy with your kids, people that are important and your partners, and be affectionate with friends, and because of the value of exchanging these microbes. But it also works the opposite way. We find people that are low performing, have a lot of disease, look awful, do terrible things, to be repulsed by them. And it's just instinctual. Nature wants you to get the best microbes. And how we live and interact with people is a big role of it. But more importantly, you've got to be intentional, Emma, about how you live your life to harvest and recruit and get those And fermented foods is an incredibly rich source way of getting those microbes. And I seem to be the only physician out there right now on the internet, social media, endorsing an intentional, deliberate practice of always chewing meat with fermented foods together.
Yeah,
and
I've never heard anybody else say that.
You will not get healthy, optimally healthy. You might shed some pounds, you might even shed a lot of weight, but you're not going to be optimally healthy without having a practice like traditional people who would always eat fermented foods with meat, like South Koreans. They routinely eat meat, and those that do eat their meat with kimchi and fermented vegetables have a much lower incidence of chronic disease. The younger generation that are adopting more of a Western diet are developing obesity and chronic disease in numbers. They're starting to rival and become similar to Western nations. So no longer are these people who have been traditionally lean and thin. Thai people from Thailand, Cambodia, Vietnam, Korea, Japan, China, they're now developing rapidly rising rates of obesity as our microbiome from Westerners are transmitted and shared into those cultures through airline traffic. And Westerners working in those countries contributing to the local microbiome in a bad way.
Yeah.
So nobody's talking about this, but really the epidemic of obesity is nothing more than an untreated infection, a disrupted microbiome.
So continuing on that, so the processed carbohydrates seem to be public enemy number one in your approach. What's the mechanism by which processed carbs specifically drive visceral fat accumulation?
It draws in the grizzlies, draws in the biggest pathogenic microbes whose food source and are in fact dependent upon simple carbohydrates and processed foods. And so you get these species of microbes whose existence is not symbiotic, but inimical to the host. And so Homo sapiens, we're not even close to identifying, have a symbiotic relationship with certain species of microbes that reside within us and cooperate with us. In fact, their life cycle is completely lived within the host. And so they help the host live longer, because when our gig is up, their gig is up. Right. But there are species of microbes that get inside a host and they complete their life cycle. And nobody talks about this in other places, like dirt. They want to get into the dirt to complete their life cycle. So they are killing you. They're doing whatever they can to get the host into the dirt. And so you want to align your lifestyle around microbes that reside within the Homo sapiens. And we've identified a lot of them are lactobacillus, bifidobacteria longum, lactobacillus rhamnosus GG, lactobacillus plantarum. There are 70 trillion of these. We could do a podcast all day long for the next 100 years, and we couldn't name all of them. But get started on the beneficial ones that are aligned through sound studies. Just lactobacillus rhamnosus GG, which is abbreviated in supplement LBG. You can get it off Amazon. Was detected to reduce cravings of alcohol 90% in alcoholics that were so severe in their alcoholism that they had liver disease. So these are people with liver disease, already inflamed hepatitis, and they reduced their cravings and also reduced their levels of drinking in alcoholics to socially acceptable levels or complete abstinence. In other words, it allowed 46 human beings to stop drinking altogether, or at least reduce their drinking to socially acceptable levels of that. And it was detected to improve their liver disease at the same time. And so you have to tease out, did the liver get better because they were drinking less? Or is it possible that these particular microbes, Lactobacillus rhamnosus GG, in fact, improve the degree of lessen the inflammation within the liver and help directly on it? So the studies will need to do some more about it, but I'm a big proponent of the microbiome, and people need to live better and understand how much of a role their microbiome plays. And I guess one last point I will make is Big Pharma understands this. The most profitable drug used to be statins to control cholesterol. Well, step aside statins. There's a bigger player out there called Ozempic and GLP-1 receptor agonists that trigger through a synthetic form of GLP-1, a synthetic peptide, a stimulation of these receptors that are inside the human body that allow the brain to work better. Satiety, meaning your fulfillment of food, you're no longer hungry, and for you to lose weight and actually start eliminating disease. And it's because Big Pharma stole it from nature. It was detected 25 years ago in people that were obese. They took feces from skinny people, put it inside fat people, and their obesity reversed. And they studied and found a natural target, GLP-1, that's produced inside the body. And they created a synthetic form with it. And because it's synthetic, it's not as healthy and as good. And so you get all these side effects, like an Ozempic face. Like 40% of your muscles are lost as you lose weight. And you get nausea and vomiting and constipation and gastroparesis.
It's very hard for people who are middle-aged to gain that muscle back. It's a hard thing for them to do.
Yeah. And then when you stop taking the synthetic, you gain back your weight with a vengeance. But if you acquire these species, Emma, the natural forms of, and many of them are actually, you can increase GLP through the same mechanisms, those probiotics I talked about. Then they live inside of you and you never gain the weight back. So that's my parting shot, point is that you really want to be intentional about optimizing your microbiome. Your targets, because we don't understand the microbiome completely yet, should be visceral fat, muscle fat, heart fat. And the last thing I gotta say it is this little tiny thin layer right here, that little white layer underneath this black line right here that you see is called superficial subcutaneous fat. And you want that. So superficial subcutaneous fat protects you from disease and lowers your mortality from heart attacks and strokes and obesity and cancer and neurodegenerative conditions. So Big Pharma, conventional healthcare, don't want you to know this stuff kills you, this stuff kills you, and this is deep subcutaneous fat and it kills you, along with the fat around your heart. They want you distracted by cholesterol instead of knowing that you got to get rid of those four things. And meanwhile, you want to build this one up, your superficial subcutaneous fat, to protect you. And the mechanisms for doing that are being intentional about improving your microbiome. And the best way to do that is through a lifestyle, starting with a meat-centric diet, the healthiest meat that you can eat. I advocate grass-fed, grass-finished meat, chewed together with ferments, along with doing some maximum intensity exercise like sprinting or lifting weights in a maximally intensive form of exercise, and also fasting and getting sunshine.
Sounds pretty straightforward. That's all you got to do. Thank you so much for your time today. We need to have another chat because I didn't even get on to specifically women over 40. But I had a whole load of questions, but there's so much to talk. It's such a big topic, such a big subject. You can't possibly cover.
Yeah, we'll do another show together down the road. And by the way, Emma, you can, if you put this out and share it with Kendra and my team. We'll make sure we can promote it and collab on it, and I'll try to answer questions of your followers as best I can, and we'll see if we can get more people getting rid of their visceral fat.
Definitely. Thank you so much for your time today, and really appreciate it.
Okay, Emma. All right, thanks for the invitation.
Have a great Christmas.
Okay, thank you. Merry Christmas to you.
And a Happy New Year.